Okay, so this next group of drugs are called fibric acid derivatives, or sometimes just called fibrates. And there's really only two: gemfibrozole or fenofibrate. And these are ligands for PPAR alpha, which is peroxisome proliferator activated receptor alpha. This is one of those nuclear transcription factors that's heavily involved with lipid metabolism. And PPAR alpha actually gets activated or turned on during periods of fasting. And so it's one of those ideas that caloric restriction and basically periods of fasting kind of resets the metabolic profile. And so that's kind of what the rationale is for kind of these drugs. There we go. Which patients get these drugs? Basically patients that have elevated triglycerides, as well as a predominant VLDL elevation, and patients that have the familial kind of inherited dis-beta lipoproteinemias. Some patients experience elevated triglycerides due to treatment of antiretroviral therapy, specifically some of the protease inhibitors, and so they can sometimes be co-treated with one of these fibric acid derivatives to kind of treat that side effect. In terms of their kinetics, basically you see excretion in the kidney. There's a high degree of protein binding with gemfibrozole. It can cross the placenta, so it would be contraindicated for pregnant women. Fenofibrate or phenofibrate, it basically has extreme hydrolysis in the urine. So both of these drugs would need to be dose modified in patients with either kidney disease or probably avoided in patients with kidney failure. All right. And so with these drugs, you can see a really beneficial reduction in triglycerides by upwards of 50%. We can kind of increase fatty acid oxidation, and so kind of, again, tricking the body into thinking that we're in a fasting state, and so you got to kind of change energy mobilization. You can also consequently see reductions in both VLDL and IDL. You can see increased lipolysis of lipoprotein triglycerides. There will be some reduction in LDL, not very much though, maybe 20%. And likewise, you'd also see a modest increase in HDL, which 30% is actually pretty good, but there's a lot of variance with these drugs. Excuse me. Toxicity, there's a lot. Rashes, GI upset, myopathies, arrhythmias, these are possible. You can see hepatic enzyme changes. Patients that have real severe kind of hepatic or renal insufficiency would probably be best to avoid these drugs. Like the statins, they can also be associated with myalgias, particularly muscle pain, and then also the accumulation of gallstones. And so all of these side effects and or toxicities may manifest themselves.